Welcome to Periodontology 2. This video has been created to assist you in developing your position paper. You will have 2 weeks to complete this assignment, which will be due on Sunday evening at the close of Module 6. Locate 2 articles from the library bank provided in the course content. The articles are categorized by surgical procedures. Both of the articles you select must be on the same surgical procedure and contraindication, condition, or risk factors. There are smoking, noncompliance, and diabetes, to name a few. Select one of the 3 surgical procedures from the videos provided. Your selection should correspond to the surgical procedures in the research articles. The surgeries for the assignments include apical displaced gingival flap, free gingival graft with alloderm, and implants in post-extraction sites. Once you have selected your surgical procedure and 2 supporting articles on the contraindications or risk factors, you will then construct your PICO question. This framework allows researchers to create searchable phrases to guide them as they seek out supporting articles for their studies. Create your PICO question based on a condition or complication presented in the articles you have selected. Risk factors commonly found in these articles are smoking, noncompliance, occlusion, and diabetes. Let's watch this short video on the construction of a PICO question.
In the clinical scenario, your patient presents with periodontal disease and wants to avoid surgery. He asks if non-surgical treatment is effective. You are familiar with performing non-surgical treatment, but are not sure if this procedure is appropriate for your patient who has diabetes. From our scenario, we will need to identify the components that will form our clinical question to research. PICO is an acronym that describes the components of a well-formed clinical question. P represents patient, population, or problem. Examples are age, gender, ethnicity, or certain disorder. I represents an intervention, exposure, or treatment. Examples are disease, risk factors, behaviors. C is our comparison intervention, or treatment if any. Examples are placebo, no disease, absence of risk factor, or alternative procedures. And O represents outcome.
Step 4 will involve the completion of the literature summary table. Review the articles in detail and complete the literature summary table. You will need to research the APA references for your research article to ensure you have written them correctly. The APA reference for the videos are provided in the syllabus and in the Module 6 agenda page. An example of the literature summary table is provided in the position paper example, which can be also found on the Module 6 agenda page. Develop a 100-word research report. Incorporate the information from the procedures introduced in your textbook, procedures conducted in the surgical videos, and information from the 2 research articles. Follow all APA format guidelines. Use the template provided to format your report. Include a cover page, double-spaced literature review, references cited within the text, reference page to introduce the assignment, the assigned textbook, surgical videos, and the 2 peer-reviewed articles, the PICO template, the literature summary table, and the grading rubric. Conclude your report with a 100-word reflection of your learning experience. Upload your assignment by Sunday, midnight, at the closing of Module 6. For those of you needing more information on APA writing format, I have included 2 videos in this assignment.
APA Formatting the Basics, a vidcast brought to you by Beth Jones and Gina Hurley in cooperation with the Purdue Online Writing Lab. This vidcast takes you through how to format a literature review following APA style. We will be using the 6th edition of the APA manual. Your instructor may have different guidelines for you to follow. Always follow your instructor's guidelines. Begin by opening your word processor program. For our demonstration here, we will use Microsoft Word 2007. APA recommends using 12-point Times New Roman font. Be sure your word processor is set to this font. Spacing, margins, and headers. APA requires all papers to be double-spaced throughout. To set your line spacing to double-space, open up the Paragraph menu in Microsoft Word. Change the default line spacing setting from after 10 point to 0 point. Then change line spacing from multiple to double. APA requires that your paper be set to 1 inch on all sides. To do this, open up the Page Layout menu in Microsoft Word. Select Margins, then click on Normal, which should have top, bottom, right, and left margins of 1 inch. You will need to create a page header flush with the left margin at the top of every page. On the title page, this header will be different. It will read Running Head. Include a short version of your paper's title in all capital letters. Your running head cannot exceed 50 characters, including spaces. All subsequent pages will have only the running head title in all capital letters. Do not include the words running head on subsequent pages as shown in this screenshot. You will also need to insert page numbers flush with the right margin. In order to make your first page header different from subsequent pages, select the Page Layout menu, select Page Setup, open up the Layout tab, and place a check in the box by Different First Page. Doing this will ensure that the phrase running head only shows up on your title page. Sections of your research paper. APA style recommends organizing your paper into the following sections: title page, abstract, main body, and references. The first of these sections is the title page. Center the title of the paper, no more than 12 words in length, the author's name without titles or degrees, and the institutional affiliation. As mentioned before, include a running head in the page header. The running head should include the words running head with a shortened version of your paper's title. Include a colon after the phrase running head. Be sure to capitalize the R in running and the entire title of your running head. Insert page numbers flush right at the top of the page. Include a number on the first page. Start a new page to create your abstract. If you have inserted a header, this page should already include the page header with your title in all capital letters. On the first line, center the word abstract without italics, bolding, underlining, or quotation marks. The first line of the abstract should not be indented. The abstract should be a concise 150 to 200 word summary of your research. You can also include keywords from your paper underneath your abstract. To do this, type, italicize, and indent the word keywords after the abstract. Then type in a few keywords that describe your paper in normal typeface. The main body of your paper should be double-spaced. Insert the full title of your paper on this page, which will be page 3. Center the title, do not underline, bold, or italicize it. Indent the first line of each paragraph in the main body of your paper. At the end of the main body of your paper, insert a new page and center the title References. Do not underline, italicize, or bold this title. Capitalize this title. Then list all of your in-text citations on this page in alphabetical order by author's last names. Double space the reference entries throughout. Some final notes. Print your paper on white 8.5 by 11-inch paper. Also, if you are using a word processor other than Microsoft Word 2007, search YouTube using the name of the processor you are using, such as Microsoft Word for Mac 2011 plus APA formatting. For more information on different types of papers in APA style, visit the Purdue OWL at the following URL. For more information on how to format entries in the references list, visit the Purdue OWL at the following URL. This has been a presentation of APA Formatting the Basics, a vidcast by Beth Jones and Gina Hurley, brought to you in cooperation with the Purdue Online Writing.
The positions paper will need a reference-cited page. This is where most points are lost in this assignment. Please watch this 3-minute video to avoid unnecessary point deductions on your grade.
APA Formatting Reference List Basics, a vidcast brought to you by Beth Jones and Gina Hurley in cooperation with the Purdue Online Writing Lab. This vidcast takes you through how to format a list of works cited following APA style. We will use the 6th edition of the APA manual. Your instructor may have different guidelines for you to follow. Always follow your instructor's guidelines. In this vidcast, we cover the basic rules of APA citation. For information on in-text citation, please refer to the links in the video description. For this demonstration, we will use Microsoft Word 2007. Begin your reference page on a separate page at the end of your research paper. It should have the same 1-inch margins and header with your essay title and the page number as the rest of your paper. Label the page References. Center the word at the top of the page, but do not italicize or put it in quotation marks. Double space all citations, but do not skip spaces between entries. To set your line spacing to double space, open up the Paragraph menu in Microsoft Word. Change the default line spacing setting from after 10 point to 0 point. Then change line spacing from multiple to double. Each entry should have a hanging indent, which means that the first line of the citation is flush with the left margin, and the second and subsequent lines are indented 5 spaces. To create a hanging indent, open up the Paragraph menu in Microsoft Word. In the Indentation menu under Special, select Hanging. Authors' names are inverted, last name first. As in the example circled in red, give the last name and initials for all authors of a particular work for up to and including 7 authors. If the work has more than 7 authors, as in the example circled in blue, list the first 6 authors and then use ellipses after the 6th author's name. After the ellipses, list the last author's name of the work. Reference list entries should be alphabetized by the last name of the first author of each work. If you have more than one article by the same author, single author references or multiple author references with the same authors in the same order, list the entries in chronological order from earliest to most recent. Present journal titles in full and maintain the punctuation and capitalization used by the journal in its title. When referring to books, chapters, articles, or web pages, capitalize only the first letter of the first word of a title and subtitle, the first word after a colon or a dash in the title, and proper nouns. Do not capitalize the first letter of the second word in a hyphenated compound word. Italicize titles of longer works such as books and journals. Do not italicize, underline, or put quotes around the titles of shorter works such as journal articles or essays in edited collections. For more information on APA citation, please visit the links provided in the video description.